Most people think diabetes announces itself in one dramatic moment. A blood test, a phone call from the doctor, a lab result that changes the course of the conversation. And yes, sometimes that is how the diagnosis finally becomes official. But the longer I pay attention to the quiet patterns of aging, circulation, nerve health, and blood sugar, the more convinced I become that the body often starts speaking much earlier than most people realize. Not always through the feet, sometimes through the hands. That may surprise you, because when people think about diabetes, they usually think about thirst, fatigue, blurry vision, or numbness in the feet. They do not usually think about the way their fingers feel when they wake up, the way their palms burn at night, the way a coffee mug suddenly feels harder to grip, the way a paper cut seems to take forever to heal. But I think that is a mistake, because your hands are not passive tools. They are one of the most sensitive, revealing parts of your body. They depend on tiny blood vessels, healthy nerves, stable circulation, precise communication between the brain, muscles, skin, and joints. And when blood sugar has been elevated for longer than it should be, those systems often start to struggle in ways people dismiss far too easily. Where we slow down, look more carefully at the signs older adults are taught to overlook, and protect health before small warnings become life-changing problems. If this kind of honest, thoughtful guidance matters to you, subscribe to the channel and stay with me, because these conversations are not about fear. They're about noticing what your body may be trying to tell you while there is still time to respond wisely. Today, I want to walk with you through 7 warning signs that may begin in the hands long before many people are formally told they have a blood sugar problem. Not because every hand symptom means diabetes, it does not, and I want to be very clear about that. But because too many people explain these signs away with phrases like, "It is just age," "I probably slept on it wrong," "My hands have always been a little stiff, that is probably arthritis," "I work with my hands, so of course they hurt." Sometimes those explanations are correct, but sometimes they are not. And I have learned that later life becomes much safer when we stop dismissing every symptom as ordinary aging. The first warning sign is tingling or numbness in the fingers. This is one of the easiest symptoms to ignore because it often comes and goes in the beginning. A little pins and needles feeling, a little deadness in the fingertips, a strange sensation when buttoning a shirt, holding a pen, or picking up coins from a table. Many people assume they slept on their arm wrong, or that they crossed a nerve, or that circulation was cut off for a few minutes. That can happen, but what concerns me is when it keeps returning, when there is no obvious reason, when the fingers feel less sharp, less awake, less precise than they used to. High blood sugar can damage small nerves over time, not all at once, not dramatically, quietly, gradually, almost politely. And because the process is slow, people adapt to it without realizing they are adapting. I think of nerves like insulated wires. When the protective covering begins to wear down, the signal still passes, but not cleanly. The message becomes distorted, and what you feel is tingling, numbness, or a strange, reduced awareness in the hands. A simple daily habit that matters here is paying attention during ordinary tasks. When you button clothes, write, use keys, text, cook, or hold utensils, ask yourself, do my fingers feel normal, or am I working around a sensation I have started to normalize? The second warning sign is burning or unusual heat in the palms or fingers, especially at night. This one unsettles people because it feels so specific. They lie down to rest and suddenly their hands feel hot, irritated, or almost electrically uncomfortable. There is no burn, no visible cause, and yet the sensation feels real. That is because it is real. When nerves become irritated by metabolic stress, they do not always go numb. Sometimes they become noisy. They send false alarms. The brain receives signals of heat or pain that do not match what is happening outside the body. A lot of people blame this on overuse, dry weather, or poor sleep. Again, sometimes that is true. But if your hands repeatedly burn at night, especially together with tingling or reduced sensation, I do not think that deserves to be brushed aside. One helpful habit here is to stop treating recurring symptoms as isolated events. Write them down. Notice the timing. Notice whether meals, stress, or late-night snacking seem to make them worse. Patterns are often the doorway to understanding. The third warning sign is weakness in grip. This one hides in plain sight. It does not always feel like pain. It often feels like inconvenience. A jar becomes harder to open. A mug feels less secure in your hand. You struggle a little more with a doorknob. A grocery bag feels strangely difficult to hold. You drop something and tell yourself you were distracted. Maybe you were, but maybe the small muscles of the hand are not receiving signals as cleanly as they once did. Hands depend on a very delicate network of nerves and muscles working together with precision. When that network is affected, people do not always notice weakness as weakness. They notice clumsiness, reduced confidence, a subtle hesitation when using the fingers. That matters because many people think diabetes only shows itself through fatigue or weight changes. They do not realize that the first clue may be something as ordinary as not trusting their grip anymore. A practical habit here is a daily hand check. Open and close both hands fully. Touch each thumb to each fingertip. Notice whether one hand feels weaker, slower, stiffer, or less coordinated than the other. The fourth warning sign is stiffness in the fingers, especially in the morning. Now, I want to be careful here because finger stiffness can have several causes. Arthritis is common. Aging changes connective tissue. Cold weather does not help. But one thing people rarely hear is that long-standing blood sugar problems can also affect the connective tissues of the hand. Over time, proteins in the body can be altered by excess glucose. Tissues lose flexibility. Small structures in the fingers and palm may begin to feel tighter, thicker, less willing to move. The person says, "My hands just do not loosen up the way they used to," or, "I can still use them, but they feel stiff and strange first thing in the morning." This is one of those signs I think older adults underestimate because it sounds so ordinary. But ordinary symptoms can still carry useful information. A good habit here is gentle mobility first thing in the morning. Slow finger extensions, soft fist-making, thumb circles. Warm water over the hands, not because that proves anything, but because it helps you notice whether the stiffness is occasional or becoming part of a bigger pattern. The fifth warning sign is dry, cracked skin that keeps returning. A lot of people stop at the surface with this one. They think soap, winter air, too much hand washing, not enough lotion. And yes, all of that can dry the skin. But when the skin on the hands becomes persistently dry, fragile, or slow to recover, I think it is worth considering what is happening underneath the surface. Skin health depends on hydration, circulation, and proper nerve function. When blood sugar is poorly controlled, the skin barrier can become more vulnerable. Moisture balance changes. Healing changes. The hands may begin to look older, rougher, or more irritated than simple weather alone can explain. The problem is not only cosmetic. Cracks in the skin can become entry points for infection, and a body struggling with blood sugar control does not always heal those openings quickly. The habit here is simple. Moisturize consistently, especially after washing, but also pay attention to whether the skin problem is responding. If it is not, do not just buy a stronger cream. Ask why it keeps happening. The sixth warning sign is cuts, scrapes, or small skin injuries that take too long to heal. This is one of the clearest reasons I do not want people dismissing hand symptoms too quickly. A paper cut, a scratch from gardening, a nick while cooking, a torn cuticle near the nail. These things happen. They should usually improve in a reasonable amount of time, but when healing is slow or the skin stays red, tender, or open longer than expected, that deserves respect. High blood sugar can interfere with healing by affecting circulation, inflammation, and immune response. The ingredients for repair are present in the body, but they are not delivered and coordinated as efficiently as they should be. I often think of healing like a repair crew sent to fix damage in a house. If traffic is blocked, communication is poor, and supplies are delayed, Even a small repair can take far longer than it should. That is what elevated blood sugar can do to a small wound. A wise habit here is to stop ignoring minor injuries. Clean them, watch them, and if your skin repeatedly heals slowly, take that as information, not bad luck. The seventh warning sign is trembling, shakiness, or unusual hand instability. This is a sign people often misread. Sometimes it is caffeine, sometimes anxiety, sometimes fatigue, sometimes medication side effects. But I have seen people describe a subtle internal shakiness in the hands that becomes more noticeable when they have gone too long without eating, when their meals are erratic, or when their blood sugar is swinging up and down more than they realize. Now, not all tremor is about diabetes, far from it, but unstable blood sugar can affect how steady the body feels. Some people notice weakness, others notice jitteriness, others say their hands suddenly feel less reliable at very specific times of day. That is why context matters, timing matters, meals matter, the whole pattern matters. A useful habit here is consistency. Regular meals, more attention to refined sugar intake, better awareness of when the shaking happens and what came before it. And when I step back and look at these 7 signs together, the message is not that every older adult with dry hands or stiff fingers has diabetes. That would be careless, and I do not want to be careless. The message is this: the body often whispers before it shouts, and older adults are too often encouraged to explain away those whispers as normal aging. A little numbness, a little burning, a weaker grip, morning stiffness, cracked skin, slow healing, unsteady hands. Each sign may have another explanation, but when several appear together, or when one keeps returning, or when your own intuition tells you this is new, different, or gradually worsening, that is the moment to stop normalizing everything. That is the moment to ask a better question. Could my body be asking for a blood sugar check? That is not overreacting. That is wisdom. Because one of the hardest things to hear later is, we could have caught this earlier. And often, earlier did not require a dramatic event. It required attention. That is all. Attention, and the willingness to take small changes seriously before they become bigger losses. So here is what I would ask you to do tonight. Take 30 seconds and look at your hands. Open them. Close them. Stretch the fingers. Touch your fingertips. Notice the skin. Notice your grip. Notice whether anything feels numb, hot, stiff, shaky, weak, or slower to respond than it used to. Not casually, carefully, because your hands do more than serve you. They may also be telling you something, and if you recognize 2 or 3 of these signs in yourself, especially if they have been building over time, I think it is worth having a calm conversation with your doctor and asking whether your blood sugar should be checked. That one conversation may give meaning to symptoms you have been living with for far too long. And the deeper lesson here goes beyond diabetes. It is about refusing to let just getting older become an excuse for ignoring the body altogether. Aging changes many things, but wisdom in aging should make us more observant, not less, more respectful of the body, not more dismissive of it, more willing to ask questions early, not only when the problem becomes impossible to ignore. That is how health is protected in later life, not only through treatment, but through attention. Now, I would genuinely love to hear from you. Have you noticed any change in your hands recently that you once assumed was normal aging? Please share your answer politely in the comments so others can learn from different experiences. And if this conversation helped you think more clearly, subscribe and stay with us. This channel is here to help you notice the quiet warning signs, ask wiser questions, and protect your health with calm, practical insight. Everything I have shared today is for general educational purposes only and should never replace direct medical advice from your own doctor who knows your personal history, medications, and health needs.